Okay, let's start with Chapter 7, Domestic and Family Violence Assessment. Domestic and Family Violence Assessment. Chapter 7. Even though um, you can call it intimate partner violence, dating violence, child abuse, elder abuse, all of those are important health problems that healthcare professionals must recognize, and you must assess these things. The Joint Commission has set standards that all healthcare settings have policies and procedures to assess, document, and make referrals for family violence, which includes child abuse, intimate partner abuse, and elder abuse. Okay, so intimate partner violence, which you will see intimate partner violence as IPV, intimate partner violence. Sometimes you'll see them just use IPV. So, intimate partner violence, defined by the Centers for Disease Control and Prevention, or the CDC, is physical or sexual violence, use of physical force, or threat of such violence. So, once again, physical or sexual violence, use of physical force, or threat of such violence. Psychological or emotional abuse or coercive tactics after prior physical violence between persons who are spouses or non-marital partners or former spouses or non-marital partners. Also is up under IPV. So child abuse and neglect is defined as child abuse at both federal and state levels. Child Abuse and Prevention Treatment Acts, CAPTA, dictates minimal standards that must be incorporated into state statutes. Most state statutes incorporate the following definitions. So, for child abuse or neglect to occur, you have to have neglect, which neglect means you're not taking care of the patient's basic needs or the child's basic needs, which means physical, educational, medical, and or emotional. Physical abuse means that any type of physical injury, and that physical injury is non-accidental. And it could be punching, beating, kicking, biting, burning, shaking, or otherwise harming a child. Even if the person did not intend to harm the child, such acts are considered abuse when done purposefully. So if you purposefully grabbed your child and shook them and said, "Stop that right now," and let's say you shook them, I don't know, and broke their arm, but you didn't mean to break their arm. But the fact that you grabbed them intentionally and shook them, they consider that as a form of physical abuse. Sexual abuse includes fondling a child's genitals, incest, penetration, rape, sodomy, indecent exposure, and commercial exploitation of a child through prostitution or the production of any type of pornographic materials. Emotional abuse is any pattern of behavior that harms a child's emotional development or sense of self worth. It includes frequently belittling the child, rejecting them, threatening them, and withholding all types of love and support. Child abuse, oops, I'm sorry, child abuse statutes or doing all of those things I said above. I do have them listed here. They're the neglect, the physical abuse, the sexual abuse, and or the emotional abuse. You can look at your PowerPoint and see those definitions. It even if you don't want to go to the book, I mean, it's the same, definitions there. So there's also adolescence violence. Adolescent violence is, and all of these things are what they consider the CDC, which is the Centers of Disease Control, definitions for these type of acts of violence. So CDC definition for adolescent dating violence includes physical, sexual, or psychological, emotional violence within a dating relationship, and that includes stalking as well. Abuse may occur in person or it can occur electronically, and it may occur with present or former partners. So, no, like sexting and all that type of stuff. If it's uh, cyber abuse, and they take that into consideration now because that means that you can be abusing a person 24/7 from anywhere. You don't have to be in their presence in order to abuse them. And there's been instances where there have been adolescents that have committed suicide over that type of thing. Now, this is a special one, the elder abuse and neglected. And as per CDC guidelines, um, elders abuse, there's like really four different types, but almost every state has some form of mandatory reporting of abused elderly and other types of vulnerable people. So, as mandatory reporters of abuse, you need only have suspicion that elder abuse or neglect may have occurred in order to call the authorities. You don't have to see it up front, but if you see signs or see things where you suspect that there's some type of abuse occurring, you can call the authorities. Many nurses, physicians, and social workers are erroneously under the assumption that must have proof of abuse before calling the authorities, but that is not the case. You can suspect it. So, there are different types of, per the American Medical Association or the AMA, definitions of elder abuse and or neglect. You have physical abuse, which basically are violent acts that result or could result in injury, pain, impairment, or disease. Physical neglect, when you have failure of family or caregivers to provide basic goods and services such as food, shelter, healthcare, and medications. Psychological abuse, where behaviors that result in mental anguish from the patient, and then psychological neglect is when, so like when you psychologically, for instance, and I'm gonna tell you the difference between abuse or whatever, because they got abuse like um you can like humiliate them or embarrass them or control them or do things like that. That's psychological abuse. Threaten them to. But psychological neglect is when You just fail to, you withhold things. Maybe you keep them locked up in a room by themselves with no type of social interaction, no type of stimuli like that. Financial abuse is when you intentional misuse of elderly person's financial and material resources. And then financial neglect is when your failure to use the elderly person's assets to provide what they need. So you may be the person that may be the guardian or the power of attorney, and you may be getting their check every month, but you may not be using it to prepare to provide for their personal needs. You know, you may have them living in squalor and might be riding around in a brand new car that you bought off of their social security check every month. You know, like, you paying your car note. So those type of things. There are various health effects of violence against women. Violent experiences have significant effects on women's health. Um, you may see where they have injury serious enough to require medical attention, where somebody might have really truly did something to them, uh, like, you know, I don't know, bust their jaw or knock their teeth out or hit them with an object or broke a leg or maybe they got a laceration or something like that from a physical, injury. And then they say that abused women have significantly more chronic health problems, neurological, gastrointestinal, gynecologic, and chronic pain. I remember when I used to work at McDill, I saw a lot of women that would come in and get gynecological checks, like the wives of some of the servicemen and stuff like that. And they would have all kind of little, infections and like E. coli, um, in their urinary tract and stuff like that, where they was doing things from behind to them and then doing it from the, just all kind of little different things they would have going on. And they would always be sickly if they was getting abused. You could just tell. Forced sex that accompanies physical abuse contributes to a host of, I just got finished saying that, right? Reproductive health problems, including chronic pelvic pain, unattended pregnancy, sexually transmitted infections, including HIV and urinary tract infections. I would see that all the time, and we would know, you know. Um, uh, Healthcare systems can be an extremely important early point of contact for a woman. Abused women have significantly more depression, suicidality, post traumatic stress disorders, symptoms, and problems with substance abuse. So you can turn them into somebody that want to commit suicide. They'll be depressed. They'll have PTSD. They'll have substance abuse problems because they just trying to make it go away. Abuse during pregnancy has serious results for both the pregnant mother and the infant, including low birth weight and increased risk of child abuse. So therefore, if the mother's getting abused and IPV, intimate partner violence, they may have a more increased chance for their child to be getting abused by their partner as well. Or sometimes I've seen it where they turn around the abuse on the child. Um, So that's why you have to be very vigilant. So by uncovering abuse in early stages, it is hoped that a pattern of violence can be stopped and long-term health problems can be avoided and or minimized. Okay. So when you see health effects in elderly people, um, they usually have complications from injuries or bleeding from trauma, um, fluctuations in blood pressure and pulse and shock, and it can lead to death. They tend to have generalized sepsis, which means that a lot of times they may have a lot of different infections and stuff from inadequate care. And then with them having being older, they have more of an immunocompromised system, assault or stress leading up to or following assault can contribute to cardiac complications and related complications for younger women or present in older sexually assaulted women. So sexually transmitted infections, which they call STIs, and related complications. You will see them in older women also. And like I said, I remember when I was working on in the hospitals as a new nurse, and I went to a neuro floor where they had a lot of patients that had had strokes, and some people had aphasia where they couldn't talk and different stuff like that as a result of strokes. And I remember seeing we had walked up on a nurse, which basically me and another nurse had walked up on a nurse that had his penis in one of the patient's mouth, and I'll never forget that, and to see that as a new nurse, and then, it was just a whole big old mess over it. But anyway, needless to say, I just wanted to let you guys know that, there's all kinds of abuse going on out there. Um, Usually when, and you see that they're kind of focusing in on elders, but what you can see is when you see health effects of violence, as far as from elder abuse, just know that physical, and all different types of financial, all different types of abuse of the elderly is coupled with neglect. You know, family or other working with age appropriate persons, they may be responsible for actions of neglect, and it may be either intentionally or unintentionally. Um, this type of neglect is often, by definition, criminal in nature. Family members or others caring for elderly persons may struggle with their own severe physical and cognitive health challenges, leading to caregiver role strain, which means basically you have a role where it's just overwhelming for you to take care of an elderly person that needs and requires so much. And as a result, you unintentionally neglect them. You know, you're not quite getting them everything that they need or making them as comfortable as you would like to make them. Select Self-neglect raises often unanswerable questions about one's right to live autonomously as well. Because, like older people, they will convince you to let them stay where they want to stay, but they can't live autonomously. They can't live by themselves because their needs may not, and you may have to uh, get some help so that if they want to stay in their house, that they can be in a position where they can be safe in their house, where they can be comfortable in their house, and where their needs are getting met, but and keep them there. Because I know a lot of older people or elderly individuals, they tend to like dread the idea of being put in a long term facility of some sort, and assisted living facility, ALF, or whatever. They dread that because in their minds, all they can think of is nursing home, and to them, that's like their psyche is it can get to them. And suspected self-neglect is also a mandatory reportable activity. So if you got a older person that's living in the house, they're living there alone, and they don't have anyone to care for them, and you know that they are doing the best they can, but you go in there and she got 40 cats in there and living with feces all over the house, or they not eating, they losing weight, they're not just being cared for, the environment is nasty, whatever. Um, you have to step in if you see that type of situation and get them out of there. I've had occasions where I've had to step in and get individuals out of there. I remember when I was living in St. Louis, I went to a lady's place and she had so many roaches. And I'm not talking about the palmetto bugs that they have here that fly around. I'm talking about nasty, little bitty brown, them little roaches, the kind when people's houses and stuff, the kind of roaches that nobody want to see in their house or nobody else's house, where you literally could not even walk in to her house. You would have to open the door and let the roaches fall off the sash of the door before you would step in. You would not take anything that could like have pockets. You would take a piece of paper, a pencil, a stethoscope around your neck. I mean, like that kind of situation. It was, you would leave there and you would literally feel like something was always crawling on you. And I went and I remember at that particular time, I wasn't in any type of management. I later did move up because we was doing IV care and stuff in the home and stuff. And I went to my director and I told her, I was like, I'm not going back there. Oh, and she just could not believe that whatever, because I was like probably like the third or the fourth nurse, and she could not believe the situation where everyone was leaving. Everybody was just, they were out, you know? So I told her, I'm not going back there. I'm not, participating. I'm not gonna be crawling. I mean, it is something worse than I've ever seen. And the lady was half blind. She couldn't really see good, and it was just she wasn't getting the care that she required. So finally, the director decided that she wanted to go see what was going on. Man, that lady got there and went in that lady's house. Within 48 hours, she was out of that joint. So it is. That's report. So when you think about neglect and that type of thing, you have to try to get people, if you can, out of those type of situations. Now, um, to treat a child in an abusive manner, um, There, if a child has a poor quality of life, there it can affect their overall health. Just like poor nutrition can affect their overall health. If you see somebody, because different things, excuse me, I gotta drink, excuse me, some water. Yeah. Okay, so different things can affect, a person's overall health, especially a child. They're up and they're trying to develop. So there are many long-term physical and psychological effects of child maltreatment. For instance, a child, every time you look up, they got a lot of different injuries always showing up to the emergency room, bruises, fractures, lacerations. It can even get to the point where it could be other things like shaken baby syndrome. And then there are more severe forms of maltreatment. Oh, like that can lead to death when, like, that shaken baby syndrome, and long-term disability such as mental retardation, blindness, and physical disability tend to contribute to, because people will get frustrated about the care that they have to give a child, because that if they're not able to tap into the correct resources, they can often get very, very, very frustrated. And what happens is, when you don't treat a child right, there's long-term effects on a child's development and their adult life. It interrupts the bond between the child and whatever caregiver they have. If they have ongoing maltreatment, they say that it changes the brain structure and chemistry. The person can have psychological, emotional, social, and cognitive dysfunction in adulthood. Research indicates that abused children will likely abuse their own children. Research indicates that adults in drug treatment programs reported abuse as children. So it's a lot of things that can play a part when you talk about any type of domestic violence and that type of thing. So, with that, there are various risk factors. And I don't know how many of y'all have looked at, like even Dr. Phil. And one of the main things that I thought about when Dr. Phil was when he was saying one of the biggest things to look for is a non biological parent in the home. So if they're young, single, and then there's a non-biological parent. So I have a few lists on here, but I'm gonna read off a big list of risk factors, things that may contribute. Not saying that if one of these things occur in the home, it's necessarily going to occur, but it's just things for you to look for. So, if a child has a disability or a chronic illness in the children, that may increase the caregiver burden. Did we just say that? Social isolation of families, which means there's nothing going on. All they can do is basically, like count on one another for the things that they need in life. Uh, Parents' lack of understanding of the children's need and of the child's development, and that comes usually from them being very, very young. Poverty and other socioeconomic disadvantages, such as unemployment and low educational achievement. If, let's say, you got a child and your child is going on up, but some parents can't deal with that. Maybe they didn't have get a chance to get an education. You don't find it quite as much as you used to, but I remember when I was growing up, there were a lot of families that was like that parents didn't know how to read and different things, and then their children are going on through school, and as their child is getting older, they're trying to ask them questions. Can you help me with this, mom or dad? And they'll be like, oh, you don't know how to, they wouldn't want to let them know that they didn't understand, the school work and stuff. Uh, so family disorganization, dissolution of marriage and violence, including um, intimate partner violence. So if you have a child and that child sees abuse going on in the family, or uh, divorce, or all of those type of things, you always have to keep your children in mind. Even when you get a divorce, I've been there with that, and it's very hard work when you don't have the sweetest feelings for your ex-partner anymore. You try your best to just make the focus be on the child, and y'all, if nothing else, can bond on the best that's for the child, even though you can't stand the individual, maybe. Or you may be a person that came out where, um, your separation was amicable. So let's all hope for that. If there's a lot of substance abuse, alcohol, illicit drugs, we already talked about young, single, non-biological parents, poor parent, child relationships, and negative interactions. Maybe that person didn't have a good interaction with their parents, so they don't feel like they don't know how, let's say like that, to parental stress and distress, including depression and other mental health conditions, community and violence. So that's just within that where they are. Parents, like I say, not being able to understand the full needs of their child. So there's a lot of dynamics that can play when you think about in terms of children, um, you know, and how they engage. Uh, and I mentioned all of these. So And also, I wanted to tell y'all, and I don't know if it'll come back up because I can't quite remember in the slide, but when you are looking at a child, and especially if it's one of the children that come in, and a lot of times they have a lot of injuries and stuff like that, you may want to look at what they call patterned injuries. And patterns injuries is just that. Like this look like this came from a belt, or this look like this came from a particular item, where it's called pattern injuries. So, routine screening for intimate partner violence, which is another name, like I said, a IPV. Routine universal screening for intimate partner violence means the following. If you're asking every woman at every healthcare encounter if she has been abused by a husband, boyfriend, or other intimate partner or ex partner, and that is required, you guys, by most of the nursing professional organizations. Um, The United States Preventative Task Force has issued a policy statement supporting the positive benefits of routine screening for intimate partner violence or IPV. So you might see USP STF, and that's the United States Preventive Services Task Force. Okay, so how do you assess for intimate partner violence? Oh my God, there's so many different ways to assess for intimate. They have abuse screening tools. Um, just like they have elder abuse suspicion indexes, and most of them have about 6 or 7 questions. I think it's like 6 questions on them. And so, how do you do? Many proceed questions with an introduction, such as because domestic violence is so common in our society, we are asking our women the following questions. And you could just really, to me, I know there's a big focusing on women, but I've known men that suffer from domestic violence. I have truly known men. Because if you think about the whole definition of what we were saying about what domestic violence is, it could be threats. Women have been known to hit and abuse men physically. They have been known to withhold things and money, or I mean, it's all about at the end who is thinking they're in control, you know, and as a result, they can be uh, very, very nasty, and they are partaking in intimate partner violence and not even realizing it. So many proceed. So you'll say those type of things, and because domestic violence has such serious health care consequences, we are we are asking all of our female patients that questions that follow. Okay, so then you can go into one of your assessments afterwards, and it alerts women that questions about domestic violence are coming and makes sure they know they are not being singled out. So basically, what they're saying is this is part of our routine screening. This is what we do to everybody. It's not just about you. And so when you do one of the like you can use the abuse assessment screening, which is AS questions, and then ask questions to assess how recent and how serious this abuse was. And so it's like a series of like um uh I guess you could say it's 1 to 6 questions, and basically, if they answer one of those with the yes questions, then you still have to wanna go into it a little bit further because it's not a denial, but a lot of times what happens is a lot of women tend to minimize the trauma of abuse. So, um, like one of the questions, number 3 says, does your partner try to control you? Where you go, who you see, how much money you can have? I mean, to some people, they may not really consider that, but that is a form of abuse. So you will follow up and you will want to get a little bit more. Um, you can, when they finish, you could be like, okay, thank you for sharing. Can you tell me more about when you said blue, 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 or when the last time that happened? And then from that point on, they'll feel more comfortable about opening up, and then you can offer that person some type of assistance. It is appropriate to show concern and distress about degree of violence. One message that needs to be conveyed is that abuse is not the woman's fault. This can be said several times. Also, express concern and reassure the patient that help is possible. Furthermore, inform the patient that several health problems can occur because of domestic violence and that this is why it is necessary for us to conduct a thorough assessment. Okay, assessing for adolescent relationship violence. We really don't have a valid screening tool like abuse assessment screen, the AAS, that we use for adults, but you need to be aware and able to observe for risk factors such as that occurs in both genders, like alcohol or substance abuse, early onset of sexual activity, you know, signs of mental illness or poor performance at school. So you need to ask pertinent questions relative to assessing whatever risk or whatever you hear from the student that may be there. And you might have to ask them, have you felt unsafe ever? Have you ever been in a relationship where you felt you were unsafe? Is a partner from a previous relationship making you feel unsafe now? Have you been physically assaulted or otherwise hurt by your boyfriend or dating partner when he or she has been angry? Have you ever been hurt by a dating partner to the point where it left a mark or a bruise? You may want to uh, basically ask that person this. And so here on page 21, there is a copy, plus there's a copy in your text of the abuse assessment screen. Assessment of elder vulnerable personal abuse and neglect, assessments of abuse and neglect in cognitively challenged persons is really complicated. And what they mean is people who have dementia, Alzheimer's, or that you don't really know, it's very difficult and hard to kind of prove that kind. Physical findings that may be inconsistent with the history provided by the patient, family, or caregiver can be red flags of possible uh, abuse and or neglect. Little different things like I don't know. Things like maybe they look a little malnourished or they look very depressed. Problems can exist at multiple levels, both physically and cognitively. So you kind of have to be aware of that. Um, because they're like very older people are very, very vulnerable when it comes to being neglected by family members and caregivers. And ask them about, they have what they call a elder abuse suspicion index, which is EASI. And like for instance, one of the questions were, have you relied on people for any of the following: bathing, dressing, shopping, banking, or meals? See, so then if they say yes, then you want to get a little bit more detail. You ask, and has anybody prevented you from getting the things that you need? They even got on their hearing aids and stuff like that. Has anyone tried to force you to sign papers or to use your money against your will? So we want to be aware of that. You know, you can look at a person and that person could be withdrawn, malnourished, uh, bruises, hygiene is bad, uh, medication issues, medicines always screwed up, and that's a sign of elder abuse. So here are some of the questions. Has anyone done the following? Look at that. Ever touched you inappropriately, made you do things you didn't want to do, took things that were yours without asking, physically hurt or scolded or threatened you, failed to help you take care of yourself? Have you signed documents you didn't understand? Are you afraid of anyone at home? Or are you alone a lot? History of traumatic uh, uh, um, and also I want to tell you they consider elderly people part of that very, very, very vulnerable population. Okay, so you want to get into that person's history. Um, you may have to look at their current health condition, like childhood abuse and prior rapes, mental status, like especially with the elders, all survivors of violence, suicide, depression, substance abuse, and anxiety. You really want to take a good look at those type of people. Screening for child abuse and neglect. You want to know if there's been a lot of hospitalizations and injuries, or does he or she suffer from any chronic medical conditions. You want to know. Do y'all remember that girl, that young lady? And I don't know if y'all ever heard of the story. Her name was Dee 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 Did. I don't know what her name. All I remember the story was the mother was basically she had that oh, what's that syndrome when you always want to make your children sick and you do two things to them to keep them sick, and for some reason I can't think of what the term of it, Munchausen syndrome, that's what it's called. And so what she would do was do things to the young girl and kept us. She had the girl in the wheelchair. The girl was sick. She was getting thousands and thousands and all kind of monies from people, and everybody felt sorry for them. And they built her a new house, and oh, the lady was just cleaning up. And then as the young lady got older, I guess she must have started noticing some things about herself and about how everything was going. And what she ended up doing was, I think, started a little bit rebelling against some of these behaviors, and where her mom was completely controlling her life. I think she ended up getting a little boyfriend. um she started showing different people that she could really walk. I mean, and she started changing. And I don't know, somehow or another she hooked up with this guy, but they ended up killing her mother. And now the young lady is locked away and all this and that, and her voice sound like a little bitty little child. And I can't remember that girl's name or who name was who. And I don't know why I keep thinking about Dee Dee or something. But all I know is that it was her, to me, her mother kind of messed her up in the head because she did her like that. So you want to look at all those type of things. Chronic medical conditions. Oh my God, mothers and stuff that take their children to all these different facilities all the time. You want to make sure, are they taking medications that may cause bruising? Do they have a history of repeated visits to the hospital? Maybe they got something really serious going on with them and they delay their hospital. So if a child is verbal, history should be obtained away from caretakers through open-ended questions or spontaneous statements. They always say when you have a suspicion of some type of abuse, you need to make sure that you don't want them around the caregivers. So when you document anything about history and physical findings of child abuse, use words child has used to describe how his or her injury occurred. Don't put your own twist. Put your quotation marks and put the words that the child uses. Remember the possibility that the abuser may be accompanying the child. If a child is nonverbal, use reports of caregivers. Know your institutional protocol for obtaining history in cases of suspected child maltreatment, and some protocols may delay a full interview until it can be done by a forensically trained interviewer. Okay, so as far as intimate um components of physical examination of a known survivor of partner violence or elder abuse include the following. You need to do complete head to toe visual examination, especially if a patient is receiving health services for reported abuse. Health evaluations for known or suspected elder abuse and neglect should include a baseline laboratory test, including a complete blood count with platelet level, basic blood chemistry, serum liver to test coagulation panel, and urinalysis. So basically, you're doing a complete little screening because you just want to make sure that everything is the way it's supposed to be, for their age and that it isn't possibly tied up with any type of abuse. So when you do that physical examination, for physical examination of children, you want significant injuries can be hidden under clothing, diapers, socks, and if they got long hair. So you want to look. So you want to look at these type of places, places that are not typical places for them to have some type of bruising. You want to look at their uh, buttocks, hands, feet, and abdomen is exceedingly rare and should arouse concern. If you see buttocks, hands, feet, and stomach, that's exceedingly rare and should arouse some type of concern. Any bruise in shape of an object should be considered highly specific for abuse. Remember, I talked about what they consider patterned injuries, where it looks like a particular object. Bruising found in non mobile children should raise concern for further injury, including fractures and intracranial injuries. So be aware of that. So you got to make sure when you document it's detailed and non-biased, which means that you're going to just write what you see. You ain't going to do nothing else. You're going to use injury maps, which basically is like where you X where the injuries are. You're going to have photographic documentation in the health record and any other aspects, including past abusive incidents, uh, quotations. You can paraphrase with use of direct quotations, written documentation of histories of interpartner violence or IPV, and elder abuse needs to be verbatim but within reason. Critical to document exceptionally poignant statements made by a victim that identify perpetrator and severe threats of harm made by the perpetrator. So you gotta make sure that you document. This picture here is a patterned punch like a brazen to the mid forehead from an assailant wearing a ring with a stone. See, that's like somebody hit her and they had something, a ring on, and they can tell by the pattern of the ring. Suture laceration is to the left eyebrow. Suture partial avulsion injury is to the nose, and punch-like contusion is to the left eye, involving the sclera, and manual strangulation related abrasion to the neck. So that is what you're looking at right there. That's pretty heavy. And there are different uh types of things, pictures. Like they got a picture of a patterned fingernail scratch to the neck. They got pictures of people with a punch injury to the left eye, uh, pictures of pattern contusions to the arms, pattern to the abdomen. Uh, they got one that looked like somebody hit somebody with a cord just by the way that the patterns are. And that's the kind of stuff that you need to look with. Look, pattern defensive posture like bruise to the right arm. You can see where the lady's holding up. So she was trying to apparently block. Maybe they were swinging something at her and she blocked it, an object or something, and it hurt her. So, a recession for the risk of homicide, this 19 item, which is basically a danger assessment. Now, listen to me, guys. Danger assessment. The danger assessment is the 19th item, yes or no instrument, and it's used extensively by nurses in the healthcare system. It starts with the calendar so women can more accurately see how frequent and severe violence has been over the past year. So it first starts with the count. And this is also an excellent assessment of frequency and severity of violence for healthcare providers to look at. And the more yes answers, the more serious the danger of the woman's situation. So this is called a danger assessment. There is a picture of the danger assessment in your book, and it has all kind of questions about drugs. Have you ever tried to? Is he unemployed? Is your person ever threaten to kill you? Uh, do they drink? Do they use drugs? Have they ever beat you when you was pregnant? Have you? I mean, it's all kind. Have they ever threatened you with a weapon? I mean, it's like different little questions and scenarios on there, and it's about 19 of them, and something, some of them they need to probably expound on. So I just wanted to let you know that that's what that is. So when she says no, but there are other intimate partner violence indicators, it can occur, you guys, in both genders. So if you suspect intimate partner violence when she says no, uh, um, but there are other indicators associated with intimate partner violence. So when the person is doing that what is it abuse assessment screen, which is like the AAS that you see on there, and you assess intimate partner violence, and they saying no, 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 and you just expecting there may be other things. Okay, they, in addition, providers might still need to be alert for conditions like the gynecological problems, the fact that they'll have sexual transmitted infections, pelvic pain, complaints of sexual dysfunction, irritable bowel syndrome, back pain, depression, PTSD, problems with sleep, and panic attacks or nerves. These can also be signs that there is intimate partner violence, even though the person may deny. When these problems occur, and especially when they persist, a thorough and repeated assessment for domestic violence is needed. In this case, an instrument such as a Webb scale may be used in addition to the abuse assessment scale or gentle indirect queries. So sometimes they have different little scales that they use that they might have to use in addition to, because of the fact that they make things. And you might have to ask them little stuff like, oh, Um, I'm concerned about your health condition. Is there any chance that stress at home is is causing these conditions? You know, is there any chance that any of this is causing, you know, these type of conditions? And you may have to ask that. Sometimes culture, it may be more difficult to determine in many cultural groups. Lifetime prevalence of domestic violence occurs significantly higher among racial and ethnic minorities, and the highest rates of interpartner violence is found in multiracial women. Death rates are higher among refugee and immigrant women. That's wow. So, into into um intimate violence partner factors among ethnic and racial minorities would include things like societal stressors, legal regulations, lack of access, and then cultural values and gender roles can definitely play a part. So, one last thing that I do want you guys to be aware of, um, there's a page that says forensic um, uh, terminology. And in forensic terminology, they have words like abrasion, avulsion, a bruise, contusion, cut, which is the same as incision, ecchymosis, hematoma, hemorrhage, laceration, lesion, patterned injury. I keep talking about that. Pattern of injuries, petechiae, puncture, stab, traumatic alopecia, and wound. Be familiar. It's in a little box that says forensic terminology. Be familiar, you guys, with that um, terminology, and we'll go from there. Okay, so we do have, I do have a little neurology lecture to give you. I think that since we pretty much done a lot of that, you guys will be real familiar and it should go relatively quick. So this is the fun finishing up with the domestic violence. Hope you have a good evening. Thanks.